Come towards me.
Every word of his.
Bas.
Sir, you have to teach us.
Okay, sir.
We don't know how to remove drains.
Before removing drains, you have to see the X-ray.
Start.
You have to see how much drain output was there. Okay, and you basically you have to see that you can safely remove drain out. You really do not need drain. If you need a drain, you have to keep it inside. Okay, if you don't need a drain, you have to remove it. So a drain can suck the air. So if the patient has pneumo, you cannot remove drain. A drain can bring out the fluid. If you have pleural effusion which is still collecting, you cannot remove the drain. Okay, and you ask the drain output. Usually in a day, pleura will secrete around 100 to 110 ml of pleural fluid. Okay, so if drain output is 100 110 ml, it's okay. If drain output is grossly more than 150 ml, more than 200 ml, you should not remove a drain. Okay, and here there is no suction connected, but whenever you remove the drain, you should turn off the suction. If you are in an ICU, turn off the suction first. Otherwise, if mediastinal drain, you will take the grafts out. Okay. Then you put the patient in a proper position. You remove the dressings. Then you start cleaning. Okay. From all the sides. From in to out. Clean the proximal part of the drain. Okay. And you clean the suture. Okay. Now, bleed. Where there are various types of knots that are taken around a wound. Okay. I cannot tell you everything, but basically you have to find. See in the here, if you will zoom out, there is a box stitch taken here. If I will close this box stitch, the incision will approximate. Once I remove the drain, imagine I have removed the drain. If I tie this box stitch, both the skin edges will come together. So this is my suture that I have to preserve. These ends I have to preserve. All the other things I can remove. Okay. So they have been tied together. So I will just separate them. Okay. Because I have to tie a knot. Then,
Sir, any advice we have to give before we have to remove drains, sir? To the patient? To inhale.
that I will tell. One second.
Sir, teach us.
Okay. Now, if you remove the drain, there is a wound there, open gap there. So air will be sucked in if the patient inspires when the hole is open. So all you have to make sure is when the hole is open, there should be no inspiration. There can be expiration, there can be standstill. That's okay. There should be no inspiration. Okay. So first you have to instruct the patient that you have to make him first you have to instruct the patient, then you have to make sure that he understood the instruction. Okay. So Hindi आता है
Try before you pull the.
Tamil आता है.
Tamil.
Who is Tamil? Tell him he has to take a deep breath in, as deep as he can take, and hold it. First instruct him that.
While you remove the
அங்கே
drain,
சொல்லுங்க
sir.
அங்கே சொல்லுங்க.
அவங்க டியூப்பை ரிமூவ் பண்ணும்போது நீங்கள் மூச்சு இழுத்து அப்படியே வச்சுக்கணும், விடக்கூடாது. சரிங்களா? மூச்சு இழுத்து அப்படியே பிடிச்சி வச்சுக்கணும். ஓகேங்களா?
Okay. When I instruct him, he has to do that. Now make him do that as a demo.
நீங்கள் பண்ணி காமிங்க.
First you make him
மூச்சு இழுத்து
take
விடுங்க.
deep breaths in and out so that he understands.
மூச்சு இழுத்து
This will happen. Many of the times patient will not be able to do it only. So first don't instruct him to hold. First let him take a deep breath in, deep breath out, because many a times patient will not be able to take a breath in only. Deep breath.
కొంచెం వలి ఆಗೋక.
Make him do a deep breath in.
ஒரு வாட்டி மூச்சு இழுத்து அப்படி விடுங்க.
இழுத்து விடுங்க இல்ல, எடுத்துட்டு அங்கே ஹோல்ட் பண்ணு.
Now first we'll see whether he can do that or not. Then we will.
ஓகே சார்.
Okay. Now tell him to.
ஒரு வாட்டி பண்ணி காமிங்கப்பா. மூச்சு இழுத்து அப்படி விடுங்க ஒரு வாட்டி.
Suppose he is your relative and you don't want pain after removal, what you will do? Local answer. Very good. Lignogel.
You will need injection.
Local. What you will apply locally? Okay. Bupivacaine, xylocaine, all that you give anesthetized. We are not injecting into the vein or artery. Local. Hmm? If you are that aggressive, it will go into LV. Superficial. Okay. Local.
Now see, once you see the drain, here you can see here that this drain is hitched to the skin. It will be put in first in the OT, and this drain will be hitched, attached with the skin. Here if you see that, it is connected to the skin there, so that even if I pull it out or push it back, it won't go. It is hitched to the skin here. So you have to disconnect that. You have to find the point where it has been hitched. Okay, here it is this point. Okay, once you will disconnect it with this point, the drain will be free to move. It can come out also, it can go in also. So if you have not hold the skin and the drain is very tight inside, and something called as very big column movement, then just you hitch and you are seeing somewhere else, in 2 seconds drain can come out also. You understand that? So what you have to do is, initially only, this is my technique, I don't know how others do, I just loop this, it will cause a bit of pain, this thread in my finger, and pinch the skin. After pinching only, and I have the drain here in my hand also. After this I will do, so that there is no chance that drain will come out on its own. It's not that only when you remove, sometimes drain can come out on its own also. Okay, now
அவங்க ரிமூவ் பண்ணும்போது மூச்சு இழுத்து வச்சுக்கோ. இப்போ இல்லை
சொல்லும்போது டென்ஷன் பண்ணாதீங்க, எதுவும் பிரச்சனை இல்லை.
now drain is been disconnected. Bring this in. Okay, now I have pinched it. Okay, I'm pinching it because when I remove the drain I will have to manually pinch the wound so that there is no hole, so that I have time to do what? But before that, once you have to take a single knot, single throw. Okay, take a single throw first, so that you only have to tie the second knot. Okay, I forgot that, I'm sorry. Now you have to pinch it. Now you have to tell the patient to take a deep breath in and hold it.
மூச்சு இழுத்து அப்படியே வச்சுக்கோங்க, விடக்கூடாது, அப்படியே வச்சுக்கோங்க.
Now remove it. I have holded it. See, I can hold it like any time I want.
Okay, patient is holding the breath. Okay. Release.
Now you can tell him to relax.
விடுங்க.
இப்போ விட்டுருங்க.
And you can tie it. 4 is enough.